Hi, everyone. Okay, I'm Dr. Miriam Smith. I just want to give an update right now on music therapy. Okay, I have near to me my daughter who is a musician, and she's going to share maybe just a word or two about music, what music does to her. And then I'll talk a little about what it does for the patient. Because, for example, I know that being on the unit, sometimes you'll have patients, definitely, they'll be playing music, and you'll see their facial expression, like they're communicating. And if there are more than one persons in a room, they will be communicating or maybe discussing the song that is being played. Now, what does music do for others or for the patients? For the patients, for example, it addresses different areas of their being, both the physical, yes, the social, the emotional, the spiritual, and of course the cognitive. And therefore, you will have like patients feeling depressed, and sometimes when they have heard or listened to music, they are being motivated, they're upbeat, they get upbeat really. And it's important for our young nurses to realize that also, that music therapy does help patients, especially when they're feeling depressed and out. Maybe sometimes they're anticipating the diagnosis, they are waiting for it, and they become so anxious. Music actually soothes the mind. Yes, it does. It soothes the mind, and it helps to relieve stress. You know that. And it also helps the patient to calm down and maybe relate in a different way and to connect with others. So, music is an important, I would say, vehicle to help patients in different phases of their illness, or their hospitalized, or their healthcare means while in the hospital setting or in a healthcare facility. So, music is one of the methods that can help. It's definitely helpful to patients. So my daughter is around here, and she might be just in the background a little bit, and she might just want to tell me what music does for her. She's a musician, and she teaches children and adults alike, but mostly children. And so I know for sure that the students react differently to music. What do you have to say about that?
I would definitely say that where music is concerned, it's very important to think about the disciplinary factors that music allows for, such as time management, working alongside different people and teams, and then third of all, also just the responsibility of learning your own piece of music. Today, I thought that was really interesting. I had a 6 year old student that was not very pleased with what he felt, he was doing musically. And I remember him asking me today, what's my homework? Is my homework to finish the bass part where I have to learn all of my left hand? And I said, yes. And he said, is that all? Am I supposed to do more? And I said, yes. Do the right hand as well and learn them together. But, at the age of 6, he's already pushing himself. He told me, please don't, I want to play the song from my head. And when I said to him, hey, you don't know it that well, he said, I want to play it from my head. And he was very strong willed about, playing the music from what he knew. Even when I was trying to tell him that he should think about using the book. And I mean, this is the type of tenacity, discipline, and also confidence that students learn at such a tender age. I think from just learning music and the
What time did
process.
you start? What was your age when you
I
started?
started when I was 4. I started playing when I was 4. This young child started playing when he was 5. So it's great to really see, the tenacity of students and individuals as they continue to grow in this particular area.
Thanks for sharing
You're
that.
welcome.
Thanks for sharing that. And Joanna is my firstborn. So you have just heard her voice right now. But next time, I know this is like part one. It's so important, as I said before, because music therapy in healthcare is important for our patients, because patients, they do have different needs. And there are times, being in a strange environment, they can become depressed. They're longing to see their loved ones sometimes, and being anxious, not being aware of what the what the diagnosis is, plus the prognosis, you know. And in this time, when we have, for example, this month, October, being celebrated as Breast Cancer Awareness Month, we know, and I have the personal experience whereby my sister was diagnosed with breast cancer a few years ago, and we all were a part of the pain and the hurt and the challenges. So we know for sure that being in a healthcare facility and being diagnosed with certain illnesses can be very nerve wracking, certainly. And so music can help to aid, and from a spiritual perspective, also believing that healing can take place through divine intervention, of course. And so music definitely helps patient. And we know, and from my personal experience, I've seen patient playing an instrument while in the hospital, or they might be listening to some music, or visitors might come with their instrument, whether they're piano portable or the guitar or whatever instrument, and play. And it lifts the mood of the patient and also those in the environment, whether they are staff or other patients. So I would encourage, I would encourage music therapy. This is like part one. We'll continue. And if you have suggestions and you want to share it, I'm going to welcome those from Jamaica. I want to welcome Gina, Gage, Pearson, wherever you are in Jamaica. That's my roots. That's my roots. Okay. Thank you so much for coming on, and you can subscribe to my channel. That's you on YouTube. You can just insert Miriam Amanda Smith. And of course, you'll see many more episodes. So this is the music therapy episode. Just this is a short, and thank you for coming on and hanging around for a while. Next time, I'm thinking of Monday night. I'll be on again, so you can share with others. Thank you so much. Subscribe to my channel. That's Miriam Amanda Smith. On Instagram at Podcastmare. And also my web is Empowering New Nurses. That's on my website. You just have look, insert Miriam. You just have to just insert what? Empowering New Nurses. And of course, my book is on Amazon. And what's it?
The guide to empowering.
Okay, my book is Empowering Nurse, the guide to empowering new nurses in delivery of high quality care, in the delivery of high quality care to all patients. Very diverse. It's diverse. So, tits and bits, pearls and nuggets are there for everyone, especially my new nurses that can help along the journey, especially the initial journey. Thank you for listening and share. Share. I appreciate you coming on. Bye bye.